Let's get to our special segment, Coronavirus Facts versus Fears. New Brunswick restart on hold after a healthcare worker returned to the province but did not self-isolate. In fact, he was working at the hospital, and now there's an outbreak of at least 6 people. So let's listen to a clip from Dr. Jennifer Russell, New Brunswick's Chief Medical Officer of Health.
Our investigation has determined that these cases are a single cluster, all related to travel. The person who traveled did not self-isolate upon return to New Brunswick. And our public health team is working tirelessly to trace contact, but based on the information I'm going to be giving you today, we may really want to rethink how many close contacts we do have on a day-to-day basis moving forward throughout this entire pandemic, no matter what color of measures and restrictions that we're in.
All right, let's start there with our experts, Dr. Isaac Bogoch, infectious disease specialist and epidemiologist, and Raywat Deonandan, he is joining us as well. Let's talk about this reopening. Okay, Dr. Bogoch, let me start with you because I want to know if you were calling the shots in New Brunswick, if you would have paused the reopening.
Tough question. It's certainly reasonable. I think what they're saying is that their contact tracing is still ongoing, and the cases that they described that are as a result of this one individual are just the cases that they have discovered to date. They fully expect to recover or see more cases of infection related to this individual. And I think it's okay to push pause even temporarily on lifting some of the public health restrictions until they have a much better sense of what is the extent of infection that's going to be caused by this one individual. It's interesting, they didn't note this in the clip, but this is a traveler from Quebec. It's not an international traveler. And New Brunswick is actually recommending people that come into the province, regardless of where they're coming from, that they isolate for a period of 2 weeks. So this is from elsewhere in Canada, which I think is a really important thing to note because moving forward, we are going to see increased travel in Canada, and certainly some places of Canada may result in infections in other parts of the country.
Yeah, and I should note that this part of New Brunswick, Campbellton, is actually just at the border of Quebec. So it wasn't like this person went very far, as you were suggesting. It was literally across the border, which doesn't really exist to most Canadians, right? Just traveling likely for a little time. Raywat, what happens now that they've identified this comes from one person, it's travel related? Where do they go from here?
Well, hopefully the contact tracing is done well and they identify all the possible other infections and clamp down on them hard and make sure that these few cases aren't a genuine outbreak leading to another epidemic. But what needs to happen now is to double down on the public health communication, the messaging. People need to understand that everyone's got a role to play. You can't be flagrant with these disciplines. One person crossing the border caused an outbreak. That's huge. And it underlines the need for an understanding of the true infectious nature of this disease and also an understanding that everyone has a part to play. It's as simple as that.
Let's talk about the fact that this person worked at the regional hospital. So clearly there are people who are going to that hospital as patients. They have compromised a system sometimes, more healthcare problems that are more complicated as well. Dr. Bogoch, do you see a whole new problem stemming just from that?
Yeah, certainly. I mean, as you point out, people are in hospital for a reason. They're sick, and you've already got a vulnerable population housed in one area. You have a potential person bringing the infection into an already vulnerable population. You have lots of close contacts, and it's just a perfect setup for something like this to spread. There's been, sadly, several hospital outbreaks. Some have made it to the media attention, others have not, but there have been several hospital outbreaks of this infection, and we know if proper infection prevention and control measures are not taken quickly, it can certainly spread. So I don't think it'll come to any surprise if there's more cases that come from this one individual. I think it's been correctly pointed out that this is a very transmissible infection. And sadly, I think this is going to be the new normal. We're just going to see a lot of spotty outbreaks of this infection periodically in various settings around the country, despite the control initiatives that we have.
Okay, let's get to a viewer question. This person said, will there be a second wave of the virus? And I guess I'm going to add to that, Raywat, is this what we're beginning to see?
So second waves come about because there are still susceptible people in the population. Not enough people are immune, so therefore the disease will find a foothold again. So a second wave at this point I would say is inevitable. The question is, how big will it be and how long it will take before it manifests? So that's why we're investing so heavily in public health infrastructure, the tracing, the testing, and the isolation protocols, because our goal here is to delay the start of that second wave and maybe quash it so much that it isn't even noticeable.
Okay, let's get to another situation that has happened this time in Saskatoon, an outbreak there because it looks like two families got together, right, for some kind of barbecue, some kind of gathering, and they were supposed to sort of limit the number of people they saw and keep physical distance. Clearly, that wasn't happening. So, Dr. Bogoch, again, to the point of people not really wanting to listen to the regulations or pay attention to the regulations, I guess because it's been a few months now and we thought we'd been through the cycle enough that we would be able to play a little.
Yeah, unfortunately, that's not the case. I mean, they're called communicable diseases for a reason. And, certainly this one is pretty easy to transmit from one person to another, especially those who are in close contact with each other. It's going to come to no one's surprise if we start to see more and more of these outbreaks. Sometimes they're going to be associated with work environments where people are just having more challenges physically distancing themselves from others because of the work. But we'll also see things like this, family gatherings, a wedding, or whatever. We are going to see spotty outbreaks of this moving forward. The key thing here is how can we mitigate these or prevent these from happening with good public health education? How can we decrease the probability of them happening by ensuring places of work are really set up for success to really reduce the risk of this happening? And of course, how can we quickly identify these and quell these before they spiral out of control and have like a small little ember turn into a forest fire? So we've got to be able to identify them quickly and quell these quickly so they don't start spreading out of control.
Okay, so let me pick up on a point here about family gatherings or other gatherings in general. And Raywat, I'll turn this one over to you. New Brunswick was ready to go into the next phase, which would allow gatherings of about 50 people outdoors, but still spaced out. So when we talk about weddings and when we talk about funerals, when we talk about anniversary celebrations, are we looking at a situation where for the summer, people aren't even going to be allowed to gather for those kinds of events in any large way?
It's a difficult question. So this disease is characterized by its love for mass gatherings, super spreading events, churches and funerals and parties of that nature. So the way that Japan got out of their emergency situation was to focus on the large gathering, super spreading events. So that might be a path we'd have to take if things are looking dire, is to cut down on opportunities for mass spreading. However, if things are outdoors, then the opportunity for spreading are minimized. If the heat is high and the humidity is high, then you get a little bit more advantage that way too. I like to think that outdoor activities with appropriate physical spacing and appropriate hygiene control, and maybe even mask wearing and avoiding using common surfaces and bathrooms and utensils, that can be managed in a way with medium-sized groups. So I'm not going to say outright that this is the norm for the coming summer, but I suspect that a size of 50 or so might be a bit too big.
Wow. And right now, for funerals, for example, some provinces are saying immediate family only, and they would cap that. Some are saying, up to 10 people. But even that, Dr. Bogoch, looks like it'll still have some sort of restriction on it moving forward.
Yeah, I think so. And it's interesting because we're going to have different provinces come up with different regulations based on their very local circumstances. And sometimes even within the provinces, we're seeing slightly different policies in different places. So, for example, Alberta was lifting some of the public health restrictions, but Calgary and Brooks were put on pause because they had some cases and transmission in those settings. So I think the provinces are going to adapt to our evolving knowledge of this virus and their local circumstances. And it's expected to see these policy changes shift and adapt throughout the course of the coming months. I think it's just inevitable. We're going to watch these adapt. So I don't think people should be alarmed or upset that senior public health leadership might be changing their mind. They're just adapting to the local environment and to new knowledge.
Yeah, I think that might be part of the problem, though, for people, is that the message is changing quite often, and it's changing very differently across the country. So to try and figure out what is new today and what I can do today and not tomorrow is challenging for some. Okay, I'm going to ask you both to stick around. We are going to continue our conversation after a break. Welcome back to our special. Tonight we have infectious disease specialist Dr. Isaac Bogoch and Raywat Deonandan, epidemiologist at the University of Ottawa. We're talking right now about modeling and the new projections in Quebec, which does show that if people don't follow that strict guideline of physical distancing, they could see a second wave in July, and the peak there could be higher than it was in April. And we know Quebec, of course, is the hardest hit place in the country. Raywat, let me ask you about that. What's the possibility of Quebec being hit even harder a second time?
It's always possible. A few things to unpack here. First is that we have to say models are not crystal balls. They're tools for guidance, not necessarily predictions. Second, a fair amount of art goes into model making, not just the science, the decisions around which variables to include, which estimates to include. Third, a population responds to this disease based upon a number of factors. Its demographics, its geography, its timing, and some luck. And also, the model doesn't include the impact of the public health powers like contact tracing and testing. However, I will say that it seems pretty clear that it might be too early for Quebec to be opening up, particularly in Montreal, given the way the numbers are trending and given what the modeling is suggesting. So the takeaway here for me is that Montreal in particular and Quebec in general needs to pull on the reins and slow their opening up activities and really invest heavily in those public health investments like contact tracing and testing to get that reproduction number down low enough so that they don't see that second wave as quickly as we think it might come. Okay,
so Dr. Bogoch, do you agree? Should Montreal slow down? And also, if they do have a second wave, have we learned enough from the first wave to do things a little bit differently second time?
So on the first part of the question, I think so. I mean, they're still having 500 to 600 new cases per day. Much of that's clustered in and around the Montreal area. That's a lot of cases per day. Models are, as pointed out, they're very helpful. They're not crystal balls, but they're certainly helpful tools. But you don't need a model to tell you that having 500 to 600 new cases per day is significant, and that it's, if you open up the economy and lift these public health restrictions, that you can certainly have significantly more cases. And it's still better than it was before. They were getting about 1,000 new cases per day earlier. And I completely agree. I mean, before things start to open up, you have to really have some appropriate infrastructure in place. Access to diagnostic testing, surveillance systems to find outbreaks of infection, rapid contact tracing, supporting people through a 14-day period of isolation who are infected or the close contacts. You really need to have these facets in place to really lift these public health restrictions in a safe manner. And if you do so, you'll likely be able to quell these infections before they really spread out of control. But I think they're not quite there just yet.
Okay, let's get to a viewer question. This one says, how can I protect myself if outbreaks speed up again? Raywat, I'll turn that one over to you.
Well, do everything that has been suggested by public health. Maintain your physical distancing. Wear a mask if you cannot maintain your physical distancing. Wash your hands constantly. Avoid touching your face. Keep yourself healthy and fit so that your immune system is strong. Stay away from people who aren't as diligent with their discipline as you are. In other words, is where the virus might be, if that's a concern of yours. Keep in mind, though, that this has never been that much about individual risk. It's about population risk. As individuals, our risk is still relatively low, most of us. And so the objective here is for us to scale up our discipline at the population level so that it does not manifest as a high caseload. So we should not be afraid of our fellow citizens. We should just be careful and diligent, right, so that en masse, we reduce the transmission rate. So just keep on doing everything the public health is asking us to do.
Okay, here is another question, but one that I'm sure is causing confusion, right? Because the rules are different across the country. I'll turn this one to Dr. Bogoch. What are the rules around getting tested? Can anyone get tested, or do you have to have symptoms? And it's confusing because initially it was, yeah, you have to show symptoms to get tested. Sometimes, even if you had symptoms, you weren't tested because you were just sent home. They didn't have enough tests to go around. So what are some of the rules and restrictions around who gets tested?
Thanks for that question. You give me the hard one. No, but as you point out, these are going to be very different depending on which part of the country you're in. Ontario, for example, has just adapted their testing policy. There's now finally capacity within the province to do more diagnostic testing, and the policy has now changed such that people in Ontario, for example, can go get diagnostic tests if they have any symptoms of a COVID-19 infection. And of course, that list of symptoms goes far beyond just fever, cough, and shortness of breath. There's a lot of other symptoms associated with it, and basically no one's going to get turned away from a COVID-19 testing center. That might be different in different parts of the country, and it might be reflective of the policies that are in place and the testing capacity that's in place in those centers. So it's important to know, depending on where you are, you can call your local COVID-19 testing center, you can call the local public health line and ask what's available. Here's my signs or symptoms, or I have none, or I had a potential exposure. It's extremely important to know what's happening locally so you know what to do.
Got it. Gentlemen, I have to leave the conversation there because we are out of time. Dr. Bogoch and Raywat Deonandan, appreciate you joining us today. Thanks for your input.
Have a nice evening.